Good evening, officers of the Jamaica Constabulary Force. Thank you for having me here this evening at this your virtual health fair. I am Dr. Shelley Wilson, and this evening I'll be making a brief presentation on lifestyle diseases and how you can manage and prevent them. First off, does anyone know what a lifestyle disease is? Yes, Sergeant Brown, that's correct. Yes, Constable Green, that's one too. Okay, Superintendent James, you're right as well. Okay, you're all right. Lifestyle diseases are ailments that are primarily based on the day-to-day habits of people, habits that detract from activity and push them toward a sedentary routine that can cause a number of health issues and lead to chronic non-communicable diseases that have a near life-threatening consequences. We can find out that lifestyle diseases are in most cases preventable, and three of the ones that affect Jamaicans are type 2 diabetes, hypertension, and heart disease. Firstly, type 2 diabetes is a long-term disease that keeps your body from producing insulin the way it should. It mostly affects people that are middle-aged or older, but it can affect young people as well. And it can make you urinate frequently, feel worn out, and also have wounds that take long to heal. Some causes are being overweight and eating poor, and you can treat and prevent this. You can prevent this by cutting down sugar and refined carbs from your diet, working out regularly, drinking water as your primary beverage rather than these juices and sodas, and also losing weight if you're overweight. And also, if it is serious, your doctor will prescribe medication. Secondly, hypertension is what we commonly call in Jamaica and the rest of the world high blood pressure. It is when your blood pressure is higher than normal. And you can find out if you have high blood pressure by taking regular checkups at the doctor to measure it to make sure it is not higher than normal. Because if you have high blood pressure, that will put you at risk for heart disease, heart attacks, and stroke. You can also manage high blood pressure by exercising about 30 minutes a day, 5 days a week. Make sure that you're not smoking. And you can also eat less salt and manage your stress well. And thirdly, cardiovascular disease is the general term for conditions affecting the heart and blood vessel. In Jamaica, can you imagine 4 out of 5 people that die in Jamaica there is some link to a cardiovascular disease. Can you imagine? Do you know how high that is? Yes, I see the chat is heating up. Yes, those are actually correct. Yes. Yes, man, just check it out at nih.gov. Yes, I can send you the link in the chat. It is a true fact. Okay. Yes, so the exact cause of cardiovascular disease isn't clear, but there are lots of things that can increase your risk of getting it, like high blood pressure, cholesterol, and diabetes, and also if you're overweight. And our ethnic background, yes, us Black people are at higher risk. So what we have to do if we're smokers, we stop smoking. We have a balanced diet and maintain a healthy weight, and also cut down on your alcohol. And in some serious cases, your doctor might prescribe medication to help with this. So in conclusion, guys, diabetes, hypertension, and heart disease, they walk hand in hand. They're like cousins. If you have one, it leaves you at risk to having another. We can prevent and treat them by exercising, having a balanced diet, not abusing alcohol or smoking, and getting some rest that our body can rejuvenate. Guys, we should not only practice these practices for preventing diseases, but we also should be doing them to have a better quality of life. Don't you all agree that we deserve a good quality of life? Thank you for having me here with you this evening, and I will be taking your questions in the chat. Thank you.